Evening, everybody. Bonfire night, fireworks definitely going on around here. So I'm hoping that it doesn't distract too much, or that my dogs don't start barking. First day of lockdown as well for England. It's been decided that, you know, dental treatment will continue. There will be no stoppage of any dental access for patients, which is quite right. We know what we're doing. We have the PPE, we have all the SOPs. We know how to treat our patients safely and to look after our staff. So things will continue as they have done. Northern Ireland's still in lockdown for a little while longer. Wales, I believe, is coming out of lockdown next week. So, yay, freedom. So well done to Wales for surviving this length of time in lockdown. And Scotland have got a 5-level system. The NHS system up there started with offering routine dental treatment. So I know it's something that the private dentists were already doing, but you know, NHS now has been allowed to start and open up with routine. So I'm hoping that dental hygienists and dental therapists will be included in that, and that they will be working a lot more than they have been allowed to. Mouth Cancer Month started or was launched this week, and the Dental Health Journal has a very significant picture on the front, and the article inside is written by our honorary treasurer, Miranda Steeples, and the picture on the front is of one of her patients. So it's quite a hard read, but it's very significant in the fact that hygienists and therapists also check for soft tissue lesions and abnormalities. So it's very, very important that, you know, we have as much access to patients as well. And unfortunately, Tony, Miranda's patient, passed away last week. So it's quite a significant and quite an important piece, because it was done with his permission. And it's a little bit of a legacy for Tony as well, to be passing on his story. So very, very interesting and very moving. Our oral health conference programme is now out, and we had an update this week, and we don't have 8 hours of CPD. We actually have 10 hours of CPD. So, you know, £30 with 10 hours CPD, you can't get better value for money than that. So you'll have started to see the speaker information and about the programs coming up onto our social media, or just log on to the website and you've got the full program there. So you know, there's something for everybody on this program. It's an amazing program, so fantastic. Exemptions. Yes, I am banging on about exemptions again. The public consultation, it's out. Deadline 10th of December. Don't leave it till the last minute. There will be a letter coming out to members tomorrow, and this letter is for you to give to, I mean, it has been written for patients. It's not from me, it's from Fiona and Michaela kind of put it together, and it's for patients and anybody who's filling out that consultation, and it gives you kind of answers to the kind of things that they would like in these boxes, so that there's a better understanding of what they're doing when they're filling in this consultation. So it's really good. So you can give it to your those that are working with you in your practice, your patients, your family, your friends, okay? And it will help them do that. Now, the other thing that we found out as well is that there's 2 ways of doing this consultation. One is as an individual, and the other is as an organisation. Obviously, BSHT will put one in as an organisation. I've also done one as an individual. As an individual, you become anonymous. As an organisation, you then get named. So your practice could put one in with their practice organisation, their name. So you've then got a better chance of having a little bit more influence with the consultation. So they can do an individual and they can do a practice consultation. So that might be another thing that, you know, if they were willing to do that, that would be fantastic. That's it for today. Enjoy the fireworks if you want to, and I will speak to you next week.